The Trump administration is considering eliminating the CDC's HIV Prevention Division, part of the reorganization of the Health and Human Services.
This move has drawn strong condemnation from LGBTQ+ HIV and health organizations, including the Mazzoni Center in Philadelphia. Josh Sanders spoke with a man who warns that dismantling the programs would undo decades of progress.
In Walnut, that was the first office.
David Fair remembers when he first heard of the disease killing those closest to him.
We called it the gay cancer. When somebody got sick, they were usually dead 5 or 6 months after that.
8 months ago, he lost his husband Rudy to kidney disease complicated by the AIDS virus.
I found him very inspirational. He continued to take his AIDS medications, but they didn't help with the kidneys.
Fair has always been a prominent leader in Philadelphia's response to the AIDS epidemic. He co-founded key organizations like the Philadelphia Lesbian and Gay Task Force in 1977 and Lavender Health in 1979, now known as the Mazzoni Center.
In Philadelphia, we early on had a much more diverse array of services available to people with AIDS who had mental illness, programs for people who were drug addicts. We had a major program for women.
Trump's executive order reevaluating and realigning United States foreign aid, along with the possibility of dismantling the CDC's HIV Prevention Division, has advocates like Fair extremely concerned.
If the president gets what he's looking to do, we're going to have more people dying from AIDS, and I believe at a rate that we haven't seen for years and years and years.
Today, there is an estimated 18,000 people living with the virus in Philadelphia. Many organizations providing HIV/AIDS health services are in limbo.
They're scared that they won't have access to their pre-exposure prophylaxis. They're scared that they won't have access to their HIV medication.
Dr. Stacy Truskin is Chief Medical Officer at the Mazzoni Center in Center City, serving the LGBTQ+ community for 45 years. The threat of no federal funding, which helps with access to HIV/AIDS medication, is concerning.
Without those dollars, we will be at a true disadvantage, and my concern is that we'll end up taking steps backwards when really we should be moving forwards to end the epidemic.
Fair says that progress needs to be prioritized.
Because there simply won't be the infrastructure.
Josh Sanders, CBS News, Philadelphia.